Hey everyone, and welcome back for another deep dive.
Yeah.
Today we're going to be tackling a topic that I know a lot of you out there are probably going through right now.
Yeah.
Nursing school.
Nursing school.
Being a nurse, it's one of the toughest but most rewarding careers out there. And of course, to get there,
For sure.
you got to go through nursing school.
You got it.
And we know it's not easy. So in this deep dive, we're going to be looking at the top 10 challenges that nursing students face,
Absolutely.
as identified by Good Nurse.
Yeah.
Which is an AI tutor that's designed specifically for nursing students.
That's right.
And we're going to give you some tips on how to overcome them so you can thrive in nursing school.
Yeah. You know what's really cool about these challenges that nursing students face is that they really are opportunities to develop some of those skills and resilience that you're going to need as a practicing nurse.
Absolutely. And I think one of the biggest ones that everybody talks about is
Yes.
time management.
Oh, yeah.
Right.
Go on.
I mean, it's classes and it's clinicals and it's studying. And
Right.
it can feel like you're juggling like flaming torches all the time.
Yeah, that's a great analogy that Good Nurse uses. That juggling those flaming torches. It really is.
Yeah.
Kind of captures what it feels like as a nursing student.
For sure.
So when we're talking about time management, one of the things that can really help is a tool called the Eisenhower Matrix.
Okay.
And this is a way to kind of prioritize all those things that are coming at you. So you can really focus on what's most important.
So it's not just, are they urgent, but are they important?
Exactly. So you're prioritizing based on urgency and importance.
Okay.
So let's say, for example, you have a pharmacology quiz tomorrow,
Oh, gosh.
a research paper due next week, and you also need to restock your scrubs.
Oh, yeah. I've been there.
Right.
Yeah.
So using that Eisenhower matrix, you can see that prepping for that pharmacology quiz that's both urgent and important.
Right.
That goes right to the top of the list.
Absolutely.
The research paper, it's important, but it's not due immediately. So you can schedule some time to work on that later. And as for those scrubs, well, maybe you can ask a friend or family member to pick some up for you.
Just wear a mismatched pair.
Or just, maybe rock a mismatched set for the day.
For sure.
So, I love this system because it really helps you prioritize
Absolutely.
what needs your attention right now
Yeah.
versus what can wait.
Yeah.
Another thing, when we're talking about being strategic is scheduling.
Oh, yeah.
So whether you're a digital calendar person or you love that paper planner, blocking out specific times for studying for classes, even for relaxing,
Yeah.
can make a big difference.
And I think, too, it's so important with nursing school to set realistic goals.
Oh, for sure.
Because you sit down and you look at these textbooks,
Oh, yeah.
and they're huge.
They're very intimidating.
They are very intimidating.
Yes.
You have to break those down into smaller chunks.
Absolutely. Break it down into those manageable chunks. And, another tip that Good Nurse points out is try to tackle the tougher subjects during your peak productivity times.
So, like, if you're a morning person, maybe do pharmacology first thing.
Exactly. Or if you're a night owl, save the lighter reading
Right.
for later in the evening.
Now, another thing, and I think this is so important when we're talking about time management,
Yeah.
is self-care.
Oh, absolutely.
And it's not just about
Right.
bubble baths and face masks, although those are great.
Those are good, too.
But it's actually fuel for success
It really is.
in nursing school.
You cannot pour from an empty cup.
That's true.
So make sure you're getting enough sleep, you're eating nutritious foods, and finding ways to move your body
Yeah.
that can really impact your ability to focus,
Yeah,
retain all that information,
for sure.
and just handle the stress of nursing school.
Absolutely. Well, speaking of things that are stressful, let's move on to our next challenge, and that's pharmacology,
Oh,
which is often considered the beast of nursing school
yeah, it is.
because there are so many medications to learn,
So many.
and they all have different mechanisms and side effects and interactions.
Right. It can feel like learning a whole new language.
Yeah.
Right. But instead of just trying to memorize everything,
Right.
which, let's be honest, that doesn't work
It doesn't really work.
in the long run.
No.
Good Nurse encourages active learning techniques.
So what does that look like in practice?
So things like using flashcards, doing quizzes, forming study groups with your classmates, and having discussions about the material.
Okay.
So flashcards, for example, those really force you to actively recall information,
Right.
which strengthens those connections in your brain.
Makes sense.
And don't be afraid to get creative, use colors, draw pictures, even come up with those silly mnemonics.
Oh, I love a good mnemonic.
Yes, they can really help you remember.
Those key facts.
And quizzes are a really good way to kind of test your knowledge.
And see where you need to
Where you need more work.
brush up.
Yes. And you can create your own You can find them online. You can even quiz each other in your study group.
Well, that's a good idea.
Yeah.
And Good Nurse mentions how important those study groups are
Yes.
for collaborative learning.
It really does make a difference when you can discuss the concepts with your peers.
Yeah.
It deepens your understanding, and it gives you different perspectives on the material.
And it helps you stay motivated.
It does. It's like a built-in support system.
Yeah.
Which is so important in nursing school.
Absolutely. And then another thing that they point out is it's not just about memorizing the drug names.
No.
It's understanding
Why?
the why behind them.
Yes. Why does this medication target that specific receptor?
Right.
What are the physiologic effects? How is it metabolized and excreted?
Right.
When you understand those underlying mechanisms, then the details start to make more sense.
Yeah.
And they're easier to apply in those clinical settings.
Absolutely. So you're moving away from
Just memorization.
rote memorization.
So really understand.
Understanding.
And that's what you need.
Exactly. And speaking of making things easier to understand, Good Nurse recommends creating visual aids for pharmacology.
So helpful.
For like charts and diagrams and flow charts.
Yes, anything that can help you kind of organize and make sense of all that information.
I wish I had thought of that when I was in nursing school.
Oh, it makes such a difference.
Yeah.
So you can think about, making a chart that compares the different classes of antibiotics.
Okay.
Highlighting their mechanism of action, maybe their spectrums of activity, common side effects.
I love it.
It really helps.
So now let's shift gears a little bit to a topic that brings together all these different areas of nursing knowledge.
Okay.
And that is medical surgical nursing,
Med-Surg.
often called Med-Surg.
Yes.
And this is where you really start to apply
Right.
all those foundational concepts to real-world patient care scenarios.
You got it.
So Good Nurse says that it's really important to revisit
Yes.
your anatomy, your physiology, your pathophysiology knowledge.
Those are the bedrock of Med-Surg.
Yeah.
And you're going to constantly be drawing on those subjects to understand your patient's conditions, to create appropriate care plans.
So how do we keep that foundational knowledge fresh?
So one strategy is to kind of integrate it into your regular study routine.
Okay.
So don't just review those subjects when you're in those specific courses.
Right.
Make a habit of revisiting those key concepts on a regular basis.
Okay.
So for example, if you're studying a specific disease process in Med-Surg, take some time to review the relevant anatomy and physiology.
So you can see how it all connects together.
Exactly. You see how everything fits together in that bigger picture of patient care.
Now, Good Nurse also recommends using case studies as a learning tool for Med-Surg.
Case studies are great.
Yeah.
They really bridge the gap between theory and practice. They're like these realistic patient scenarios. Right.
And they really challenge you to apply your knowledge to make clinical decisions.
So it's like a simulation,
Exactly.
but in a safe learning environment.
Exactly. You can analyze patient data, identify potential problems. You can develop nursing interventions.
Yeah.
You can evaluate outcomes just like you'll do in real life.
And speaking of support, let's not forget the power of mentorship.
Oh.
During clinical rotations.
Blast.
I mean, those experienced nurses can be incredible guides, offering support and feedback and all those insider tips that you just won't find in your textbooks.
They've been there. They've done that.
Yeah.
And they can really help you navigate the complexities of real-world patient care.
Absolutely. And speaking of things that can feel overwhelming, let's address another major hurdle.
Yes.
That every nursing student faces.
The NCLEX.
The NCLEX.
That big exam.
That big test.
That stands between you and becoming a licensed registered nurse.
Yeah. So Good Nurse emphasizes starting your NCLEX prep early.
Okay.
Don't wait till the last minute.
Right.
You want to gradually build your knowledge and those test-taking skills over time.
And those practice questions are so important.
They are so important.
And it's not just about testing what you know.
Right.
It's about getting familiar with the NCLEX format.
Yes.
And the types of questions and the critical thinking skills that are required.
It's like training for a marathon.
Right.
You wouldn't just show up
and expect to run 26 miles.
at race day.
Yeah.
You'd have to train for it.
Right.
And the practice tests are also really valuable for figuring out where your weak areas are. So you can focus your study efforts there.
You already talked about some pretty intense academic challenges here.
Yes, we have.
Time management, pharmacology, Med-Surg, that looming NCLEX.
Yes.
In our next part, we're going to talk about some of the other challenges, including managing a heavy workload, adapting to new technologies, and overcoming financial constraints. Yes, we are.
But before we go, I want to emphasize something that Good Nurse pointed out.
Okay.
And it's really resonated with me.
What's that?
They frame these challenges not as roadblocks,
Okay.
but as opportunities for growth.
Oh, I love that perspective.
Yeah.
Yeah, because every challenge that you face in nursing school,
Yeah.
it really does equip you with the skills and the knowledge and the resilience that you need to excel as a nurse.
And you don't have to navigate these challenges alone.
You have your peers, you have mentors, instructors, and you even have online resources like Good Nurse.
Exactly.
Definitely.
So until then, take a deep breath. Everybody grab your favorite study snacks.
Yes.
And remember,
You got this.
you got this.
You got this. Welcome back to our deep dive into the top 10 challenges you'll face in nursing school.
Now, in the last part, we talked about time management and active learning when it comes to pharmacology,
Absolutely.
and the importance of Med-Surg and how it brings together all that foundational nursing knowledge.
That's right. And starting that NCLEX prep early and self-care is so important.
Yes.
And now I think we're going to move on to a challenge that every nursing student can relate to.
Okay.
And that is
What's that?
managing that heavy workload.
Oh, yeah.
It's like there's always another lecture to attend a chapter, to read an assignment, to complete a clinical shift, to prepare for.
It really is a juggling act.
It is.
And one of the most effective ways to manage that workload is to be organized.
Oh, for sure.
Keep your study materials tidy. Use a planner. Prioritize those tasks.
And prioritizing is key.
It is.
It is so easy to get caught up in the urgent and lose sight of the important.
Exactly.
Like what's important is seldom urgent and what's urgent is seldom important.
Exactly. It's about learning to discern
Yes.
what needs your attention right now and what can be scheduled for later.
And speaking of scheduling,
Yes.
remember that those healthy habits
Oh, so important.
aren't just good for your physical well-being.
Yeah.
They impact your mental clarity and your ability to focus. So make sure you're getting enough sleep,
Yes.
eating nutritious foods,
Yes.
and getting some exercise.
Yes, it makes a world of difference.
Take care of your body. It's the only place you have to live.
Oh, I love that.
And if you're feeling overwhelmed, remember,
Yeah,
you don't have to go it alone.
that's right.
Reach out to your instructors, your academic advisors.
Your classmates.
Your classmates are there to support you.
Yes, they are.
And asking for help is a sign of strength,
Absolutely.
not weakness.
It shows that you're committed to succeeding.
Absolutely. Well, speaking of staying ahead of the curve,
Yes.
let's move on to a challenge that is becoming increasingly relevant in nursing, and that's adapting to new technologies.
Oh, yes. Technology in healthcare is constantly evolving.
It is.
Think about electronic health records, telemedicine platforms, sophisticated monitoring equipment. These are all things that you're going to need to be comfortable with as a nurse.
It can feel intimidating, though.
It can, especially when you're already bombarded with so much information. Yes.
But the key is to really embrace those hands-on practice opportunities that you're getting in labs and in clinicals. The more you interact with the technology,
Yeah.
the more comfortable you'll become.
It's like learning a new language.
It is.
The more you immerse yourself, the more fluent you become.
Exactly. And, there are also a lot of resources available online.
That's true.
Tutorials, webinars, even YouTube videos can help you learn at your own pace. Get up to speed on those new systems and trends.
So approach it with a positive attitude.
Yes.
Right. Those who embrace change and continuous learning are the ones that are going to thrive in this ever-evolving world of nursing.
For sure.
Now, let's address a challenge that I know a lot of nursing students face.
Okay.
And that's financial constraints.
Oh, yeah.
Nursing education, it's a significant investment.
It is.
And the costs add up really quickly.
They do.
Tuition, textbooks, uniforms, equipment.
Yes, it can be overwhelming. It can be, but the good news is there's often more financial aid available than people realize.
Absolutely there is.
So don't be afraid to explore your options, scholarships, grants, work-study programs.
Yes, there's a lot out there that can help ease that financial burden.
And if you're feeling lost or overwhelmed, reach out to your school's financial aid office.
Yes, those folks are there to help.
They are.
They can guide you through the process, explain different loan options, connect you with resources that you might not know about.
And don't forget about budgeting.
Oh, yes, good old-fashioned budgeting.
Yeah.
Tracking your expenses and seeing where you can cut back can make a big difference.
And those little things add up.
They do.
Maybe pack your lunch instead of eating out.
Right.
Look into renting textbooks.
Yes.
See if you can share resources with classmates.
Great ideas.
So it's all about being resourceful.
Absolutely.
Finding creative solutions.
Yes.
Now we've come to the last challenge on our list.
Okay.
And it's one that can trip up even the most prepared nursing students.
All right, what's that?
Selecting the most correct answer on those multiple-choice nursing exams.
Oh, yeah.
You think you know the material cold, and then you get there, and you're faced with 4 answer choices that all seem plausible.
They do, and that's where that critical thinking comes in.
Yeah.
These exams are not just about memorizing facts. They're designed to test your ability to apply your knowledge, analyze data, and make sound clinical judgments.
So how do we avoid falling into those multiple-choice traps?
One of the most important things is to really dissect the question before you even look at the answers.
Okay.
Identify those keywords, rephrase the question in your own words if that helps,
Right.
but be crystal clear about what is being asked.
That's like being a detective at a crime scene. You've got to get all those clues.
Exactly. You got to gather all the evidence before
Yeah.
you can solve the case.
And pay attention to the details.
Oh, yes. All those little details in the question stem.
Yeah.
The patient's age, their medical history, their vital signs, their medications. All of those things can be important in helping you select the most accurate answer.
It's about connecting the dots.
It is.
Seeing the bigger picture.
Absolutely. And something we've talked about a lot in this episode.
Yeah.
Prioritize patient safety.
Yes.
That should always be your guiding principle, especially on those exams.
Definitely.
So if you're not sure which answer is best, ask yourself which option is the safest for the patient.
That's a good rule of thumb.
It is. And don't forget about that elimination method.
Oh, yeah.
If you can rule out 2 answers that are obviously wrong,
Right.
then your odds of selecting the right answer
Yeah.
between the remaining 2 are much higher.
Right. It's like those old logic puzzles.
It is.
Where you eliminate the impossible.
Yes.
And whatever remains, however improbable,
Must be the truth.
must be true.
Exactly. And of course, practice makes perfect.
Absolutely.
The more you work through those NCLEX style questions,
Yeah.
the more comfortable you'll become with the format, the wording, the critical thinking.
And you're training your brain to think like the test makers.
You are.
Now, we've talked a lot about Good Nurse throughout this deep dive.
Yes, we have.
For those of you who haven't had a chance to check it out yet,
Yes.
can you give us a little recap of what it is and how it can help nursing students?
Absolutely. Good Nurse is an AI-powered tutor
Okay.
that is designed specifically for nursing students. It's like having a personalized study guide, a practice question bank, and a supportive mentor,
Wow.
all rolled into one.
That sounds pretty amazing.
It is. It's a great tool.
Yeah.
You can ask it questions about anything from pharmacology to pathophysiology to NCLEX prep. And it's going to give you clear explanations, helpful resources, and even customized quizzes
Oh, wow.
to test your knowledge.
So it sounds like it can really help students navigate those nursing school challenges that we've been talking about.
Absolutely. It can help you break down those complex concepts, create a structured study plan, even track your progress.
Wow.
So you can see where you need to focus your efforts.
All right, so future nurses, if you're feeling a little bit overwhelmed by nursing school,
Yes.
remember, you are not alone.
You're not.
There are some amazing resources available to support you,
There are.
from your peers and instructors to innovative tools like Good Nurse.
That's right.
So embrace the challenge, stay curious, ask for help when you need it, and never stop learning.
Those challenges you're facing right now in nursing school, those are shaping you into that competent, compassionate, and resilient nurse that you're going to be.
I love it.
You got this.
We believe in you. All right, future nurses, welcome back to our final part of this deep dive
Yes.
into the top 10 challenges you'll face in nursing school.
Absolutely.
So we've covered time management, we've talked about pharmacology, and that sometimes overwhelming world of Med-Surg,
Right.
and we've even talked about technology and finances, and of course, self-care, so important.
So important.
And starting your NCLEX prep early and seeking support.
Absolutely.
Now I think we're at our 10th and final challenge.
Yes, we are.
And you said this one can be really tricky,
It can be.
even for the most prepared nursing students.
It can be.
I'm very curious. Tell me more.
So it's something that you're going to encounter on every exam.
Okay.
And it seems so simple,
Yeah.
selecting the most correct answer on those multiple choice nursing exams.
Oh, I remember those exams.
Yes.
You think you know the material,
Yeah.
and then you get there and you're like, wait a minute, all of these answers could be right.
Exactly. And that's where the critical thinking comes in.
Okay.
These exams are not just about, being able to regurgitate facts and figures.
Right.
It's about applying that knowledge, analyzing data,
Yeah.
making sound clinical judgments.
Okay, so how do we avoid those multiple choice traps?
So one of the best strategies that Good Nurse talks about
Okay.
is to really break down the question before you even look at the answers.
Okay.
Identify those keywords, rephrase the question in your own words if that's helpful,
Mm.
but make sure you're clear on what is being asked.
So it's almost like you're a detective at a crime scene.
Exactly.
You have to get all those clues before you can
Before you can solve the mystery.
solve the mystery.
Yes.
Okay.
Pay attention to those details in the question stem.
Yes.
The patient's age, their medical history, vital signs medications.
Mm.
All of those things can be really important clues
Okay.
to help you select the best answer.
It's about connecting the dots, seeing the bigger picture,
It is.
and of course, remembering to prioritize patient safety.
Oh, always.
Right. That should always be our guiding principle
Absolutely.
when we're answering these questions, especially.
Especially. So if you're unsure
Yeah.
which answer is best,
Mm-hmm.
ask yourself which one would provide the safest outcome for that patient.
That's a good rule.
It is.
And I know you mentioned in the last part, but it bears repeating,
Yes.
that elimination method.
Yes. If you can eliminate two answers that are clearly wrong,
Right.
that increases your odds of getting the right answer significantly.
Yeah. That's always a good strategy. And of course, practice makes perfect.
Always.
The more you practice those NCLEX style questions,
Yes.
the better you're going to be at it.
The more comfortable you'll be.
Now, we've talked a lot about Good Nurse in this episode.
We have.
Can you remind everybody one more time
Yes.
what it is and how it can help nursing students?
So Good Nurse is an AI-powered tutor for nursing students.
Okay.
It's like having that personalized study, a practice question bank, a supportive mentor,
Oh, wow.
all in one.
That's amazing.
Yeah, so you can ask questions,
Hmm.
from pharmacology to pathophysiology, NCLEX, prep, anything.
Okay.
It's going to give you clear explanations, helpful resources, and it will even create quizzes for you.
So it sounds like a really great tool for helping students navigate all these nursing school challenges
Absolutely.
that we've been talking about.
It is. It can help break down those complex concepts,
Mhm.
create a structured study plan,
Mm-hmm.
even track your progress.
Well, that sounds amazing.
Yeah, it's a great tool.
All right. So to all our future nurses out there listening,
Yes.
if you're feeling overwhelmed by nursing school, remember, you are not alone.
You are not.
There are some incredible resources available to support you, your peers, your instructors, and these amazing new tools like Good Nurse.
Absolutely.
So embrace the challenges, stay curious,
Yes.
ask for help when you need it,
Yes.
and never stop learning.
And remember those challenges that you're facing right now, those are shaping you
Yeah.
into the amazing nurse that you're going to be.
Absolutely.
You got this.
We believe in you.